Hello, everyone, and welcome to this Faith Chat. Today, we're going to have a conversation with Sister Leanne Hudak, who's involved in the Elder Care Committee, which is part of the Caring Network. To set the table, perhaps you can tell us, Leanne, why you're interested in elder care. Why do you think it's important?
Because of my own experience being a primary caregiver to my parents, um, I just had a huge steep curve of learning, critical decision making, and personal growth that I needed to share with other people in our community. Um, to have proactive conversations about elder care through the lens of God expects us to be very active, respectful, and honoring our elders in our communities. And regardless of whether they deserve it or not, which is a clear mirror of how God cares for us, whether we deserve it or not. And of course, we don't. So, especially in this time of huge vulnerability, we can engage in this topic very actively and honoring that expectation that God has as part of the Ten Commandments.
Now, you mentioned this is a very vulnerable time. We see the isolation, the perilous nature of life, basically, and this is perhaps exacerbated in the senior demographic. What are the principal challenges that you see the more senior elements of our community facing?
The primary challenge that, because of course I had to do research to have this faith chat, so I called around. And the primary challenge is that pre-existing conditions will be exasperated and will cause them exposure because they have to go to hospital or go to health appointments, and that they will get coronavirus transmitted to them. They will be exposed to that. They feel uneasy and unsettled, and that really is stress, isn't it? And stress, we all know, compromises our immune systems. It increases our risk of predisposed diseases we have, and it affects our cognitive health, prolonged stress. I also talked to caregivers who are very, very busy at the moment, as you can imagine. And in their professional lives, they are, it's playing out minute to minute. They are very, very busy, very focused. They come home exhausted. And the fears of them are that they are going to get sick and that they are going to put and expose their families who they're living with to coronavirus. So, very, very challenging times for sure.
James tells us that pure religion is to care for the widows in their affliction. And we'd ask ourselves, what sort of concrete steps can we take to help this situation? Are there things that we can do as more junior brothers and sisters to help the more senior elements in our ecclesias?
Absolutely. Call them, call them, call them, call them. So I spoke to somebody who's on an assessment team, a health team, and they gave me a amazing list. And I'll just rhyme this list off because it's pertinent to this conversation. They call daily their vulnerable members and vulnerable patients to establish that they have food, that they have medication, that they're getting deliveries, so those are being facilitated appropriately, that they're getting exercise. Who else is calling them? Laundry and garbage, are they being managed? Are they at risk of elder abuse? Are they a caregiver? Who do they call in crisis? And do they have financial stress? Do they have money? Um, the primary goal of these calls is to establish, are they safe? Are they well? And dealing with the health sciences of mental, physical, spiritual, financial, emotional health. Are they safe? Are they well in all of these categories? In my experience of just calling to do the research for today's Faith Chat, the third person I called was in crisis.
Mm.
Third person. It was, I mean, my stomach lurches just thinking about it. So they had run out of basic food. They didn't have clean laundry, and they didn't know how they're going to get their garbage out for garbage day the next day. They were distraught and needing help, real help. Um, and that just reinforced that call. Because if I'd called 2 days earlier, they probably would have been fine. But the day I called was, I instead of asking them, obviously, how does your faith feel today? It was just jump into this assessment list from their basic, issues with food. This list pulled out the laundry and the garbage issues. So it was it is really important to reach out and call every vulnerable member. And be aware of the intention of our speech when we call, with compassion, sincerity, and engage them with active listening. We should be, establishing rotating callers for each at-risk member, and specifically looking at, are they safe? Are they well?
Yeah, that's a very comprehensive checklist. Thank you for that. Worst case scenario, what happens if someone contracts COVID-19? Is there anything that we can do as a lay community without medical expertise?
So of course, yes, there's going to be guidance with your healthcare professionals about what the health procedures you need to do. But my soapbox actually is about your care team. Everyone, in my opinion, should already have an established care team. So when I facilitate older adults finding their care team, it's actually an incredibly beautiful process. And I'll just share some of the key things with you now. So I start with 3 categories. Your friends, who know you well. You can vent to them. You can talk very openly with them. They're not going to judge you. They will hold space for you and support you. Then you have a category 2 of your fixers. Who are those people who will just come in and get it done? So active fixers. And you also have your verbal fixers who will tell you they're very good at problem solving, and they'll give you their opinion on how you can handle this part of the crisis. And then of course you have professionals who we talked earlier about, so those in specialized fields who are going to ask those pertinent open-ended questions to direct you to diagnosis, to tools to help you, and for diagnosis, and GPs, counselors, government websites, Ministry of Health. I think if you have all these 3 categories, you have names under them, you have an active list, and then you actually assign tasks to each of those. And again, to cover those health sciences that I talked about just earlier, you really get that care team coverage, that when crisis hits, because we all know that COVID-19 is not going away anytime soon, that we have a team behind us to really help. Be proactive. My sister and I, when we cared for mom and dad, We didn't have any of this speech, of course. It was the learning curve. And we had to set up our care team in the midst of crisis. And it was really hard and it wasn't done well. We fumbled our way through it. And we have this opportunity, respectfully, I'm, fifth week in isolation, part of our most fortunate group of loved ones are safe and sheltering at home. We have a bit of time right now in Southern Ontario specifically, where we are, that we can get a crisis team in place, because it's a web, isn't it? Because we're a community. So we all know each other, but who do we really call on as individuals? If my husband gets COVID, if I get COVID, who are we, what is triggered to actually get those, that comfort, that caregiving in place?
Good questions. To wrap up, how does this challenge affect our faith? Can you give me perhaps a caregiver's perspective first off?
Absolutely. So the caregivers I spoke to, and we'll draw back to that mirroring of, God expects us to be caregivers, and they see firsthand that I am in God's care. And thankfully, our omnipotent and perfect caregiver, right? We are in his hands. And those unsettled and fearful emotions of vulnerability, isn't it amazing that it seems human nature is such that faith and vulnerability are going hand in hand, and all of them with complete sincerity. And I was like listening for that on those calls, but without hesitation, they're all saying my faith is stronger. And that's beautiful. Thank goodness.
And what about from the perspective of a more senior member? How is their faith being developed in this current environment?
So the older adults I talked to were very aware of their trust in God and that God is in control. They are engaged more in their readings. They're engaged more in talks online and with their families than they would normally be. That was certainly a topic of conversation in every call. Yeah.
Well, thanks very much for joining us today and sharing your insights, Leanne. We appreciate it. May God be with all of you.
Thank you, Alan.